All right. So, what we're going to talk about tonight is blood flow restriction training for hypertrophy. The best outcome we can get with BFR. I mean, we can get increased muscle mass in as little as 3 weeks, increased strength in about 4 to 5 weeks, compared to normal high intensity training is going to take anywhere between 12 and 15 weeks. So when we're looking, especially from a rehab standpoint, using light loads and trying to get people back to where they want to be, using BFR for hypertrophy is a total game changer. Just to reintroduce myself, my name is Ed LaCara. I am double board certified in sports medicine and rehabilitation. I have a private practice in Dallas, Texas, where we do functional medicine, lots of, mostly sports medicine, functional medicine, kind of whole body wellness and aesthetics. I am the director of education for Smart Tools. I wrote a book. I just named it after myself, Dr. LaCara's Approach to Blood Flow Restriction Training. And I've been the director of education for Smart Tools Plus since about 2015 or so. If you want to follow me on IG, that's the QR code that's up on the screen. I'd appreciate a share. That'd be awesome. And if you're watching this as a replay on YouTube, what do they say? Smash the like button and or maybe follow, something like that. All right. So what I want you to get out of tonight's lesson is just what BFR training is, if you're new to it, how muscle hypertrophy happens, why we think or accelerates muscle growth, because we don't exactly know fully, safety principles and pressure guidelines, and then basic BFR hypertrophy protocol. So what is BFR training? BFR is a technique used to control pressurized medical cuffs to partially restrict venous blood flow while allowing arterial inflow. Essentially, what happens is I put a cuff on my arm or my leg. I'm restricting the amount of blood flow that's going into the limb, and that's creating a hypo or a lack of oxygen environment, and it's also creating a high metabolic environment, and I'll explain that a little bit more. Most of the time, we're exercising or using the cuffs with a little bit of blood flow going into the limb, and then there are some passive techniques that we use where you're fully occluding both arterial and venous flow into the limb. So no arterial and no venous flow in or out of the limb. It kind of looks like this, where I have the cuff on my upper leg. Red is imitating like vascular flow or arterial flow where it's oxygenated, it's going into the limb. And then blood flow is returning back to the heart through the venous system. That's being depicted here by the blue. When I inflate that cuff, a little bit of trickle in is happening with the red, but that blue gets blocked fully. So the venous return gets blocked. We don't do it for long periods of time, no more than 20 minutes when we're walking or doing aerobic capacity training. During normal lifting, we're only going to do that for about 5 or 6 minutes. But why it's a game changer for those people that can't lift heavy loads is that we're able to mimic high intensity training. High intensity training is defined as lifting weights that are between 65 and 90% of your 1 rep max. So we're going to think about weights that we can only do probably anywhere between like 4 and 12 times. So low reps, high load. But there are a lot of people that cannot lift those heavy loads, whether they have injuries, like I use it in rehab all the time, or somebody has osteoarthritis, or they're older, or they can't get their heart rate up too high. We can use light loads, but mimic high intensity training. And that's where BFR really helps people, both in rehab and performance. The other thing to note is that hypertrophy changes occur very quickly with BFR. So within 3 weeks, you're going to see increased muscle mass or hypertrophy. And that normally would take something between 12 and 16 weeks using normal high intensity training, according to the American Academy of Sports Medicine. How does muscle hypertrophy work? Now, I want you to think a little bit differently than what is commonly thought is that hypertrophy or muscle size equals strength, because it doesn't. Those are two different things, and we train them two totally different ways. Today, I had a patient that came in and really wanted to increase his muscle mass, and he was training with too heavy of loads. He was really doing strength training. And so I tried to explain to him, we need to increase the amount of repetition so that we're really getting something called cellular swelling or fluid into the muscle cells to create that swelling effect, which will help with the hypertrophy, compared to increasing muscle or increasing weights or resistance, which are going to be more of a mechanical stressor and will help us with strength. So we train them differently, but we primarily think hypertrophy is driven by mechanical tension, this metabolic stress, and then a little bit by muscle damage itself. And then the body repairs that tissue, and then it grows back a little bit longer. So we're using these kind of three pieces of the pie. Something that's not included in that as well is that we also know that testosterone and other metabolic factors like insulin growth factor and growth hormone and other things are activated when we lift weights, especially heavy weights. And we also know that that also gets increased when we lift using blood flow restriction. So if you're comparing mechanical or heavy weightlifting compared to metabolic, like BFR, the light loads, these are the kind of the differences. Mechanical, it's going to be the high external load. Think about like what happens when we do a 1 rep max. You're going to create this high tension on the muscle, and that's going to be the primary reason why you're getting the adaptation. Take away that heavy weightlifting, we have to do something else to get these gains. And so by exclusion, we know if it's not a heavy mechanical or mechanical tension, then it's got to be due to something else. And what we think is that it's due to this metabolic stress. It's that burn that we feel, lactate production, hydrogen ion production, other things that are produced when we're contracting muscle, especially under load, because you're trapping those metabolites because of the cuff. Those metabolites can't leave as easily. And so it starts to stress the tissue in a different way. Essentially, the take home is BFR mimics high intensity training, but without the heavy load. And if we can reduce the heavy load, we can reduce injury, we can reduce the amount of stress on joints, and we can train people when they can't lift those heavy weights. We think BFR stimulates hypertrophy by increasing the mTOR activation, which is essentially the protein synthesis or one of the protein synthesis pathways, increases insulin growth factor 1 release, increase in muscle fiber recruitment, especially type 2 fibers. Those are the ones that are more likely to increase in size and strength, increase in lactate accumulation, increase in cellular swelling, increase in muscle protein synthesis. And then I think what's interesting is we also think that there's a down regulation of myostatin. See, our bodies don't want to put on muscle mass. That's why it's so hard to put muscle on. It takes a lot of work, a lot of consistency in a long time. And the reason is that our body doesn't know that we have Safeway or Tom Thumb or Publix right down the street and we can get any food that we want at any time. It thinks that we have to hunt and gather. That hunter and gathering used to take a lot of energy in order to get our food. And if we put on a lot of muscle mass, what do we have to do to keep that muscle mass? We have to eat a lot. We have to consume a lot of calories, and that costs a lot of energy back in the day. So we have these built-in systems that don't allow us to build muscle. We think that BFR actually downregulates that gene to allow for that earlier adaptation or hypertrophy. The occlusion that we get from the cuffs appears to increase muscle strength and size faster. The brain is forced to recruit the fast twitch muscle fibers earlier. It creates fatigue earlier in type 1 and type 2 fibers. The metabolites accumulate and we get these growth signals like testosterone and growth hormone that help with the muscle building. So some of the benefits of BFR for hypertrophy: builds muscle efficiently, there's low impact on joints and tendons, helps to maintain muscle during injury, accelerates the rehab process and progress, perfect for busy adults. We can get workouts in quickly. I have patients take their cuffs with them on vacation so they can get quick workouts in just in their hotel room with body weight or with resistance bands. I have busy professionals have cuffs and they do their workouts while they're traveling if they don't have time to get to the gym or get to the hotel gym. And then, of course, for our aging population that can't necessarily lift heavy weights, these all can be very, very helpful for maintaining their muscle mass and reducing what we're going to talk about next, which is sarcopenia, which is the gradual decline of muscle mass over time or while we age. So BFR safety, we always want to know that it's safe to continue. BFR is safe when pressures are measured using a limb occlusion pressure, meaning that we know how much pressure is required for the limb to fully occlude, and then we exercise at a portion of that, usually a percentage. You're using properly designed cuffs They're wide, they're safe, they're adjustable, they have automatic release. We like sessions to be supervised, but many people, once they learn techniques, it's very easy. You just want to know that you're trained and you're safe in providing this, especially if you're providing this for others, like if you're a strength coach or a physical therapist, athletic trainer, occupational therapist. Those are the professionals that are using these on patients and clients. And we just want to make sure that contraindications are screened and it's safe to proceed. So pressure guidelines, when we're using blood flow restriction, we typically are going to use anywhere between 40 and 50% of that limb occlusion pressure. And then for the legs, we're going to use somewhere between 60 and 80%. So when we're doing hypertrophy training, what we do is we use higher percentage of the LOP. So for the arms, we use 50%. Typically for the legs, I'm using somewhere between 70 and 80%, but we're going to be on the higher ranges, but we're going to use lighter loads. So we're only going to use about 20% of our 1 rep max, so very low load, something that you can easily do 30 repetitions of. And the reason we're doing that is to improve the cellular swelling effect, or the ability for fluid to get pushed into the muscle cell itself. And that's what's going to help us primarily with that hypertrophy. You should avoid BFR and consult a medical provider if you have active clotting disorders, you have uncontrolled hypertension, you have peripheral vascular disease, active infection, or pregnancy. Pregnancy is not an absolute contraindication. It's relative, but you'd want to be making sure that you don't have any high blood pressure, preeclampsia, things like that, and get clearance from your OB. So to perform BFR safely for hypertrophy, we're going to use either SmartCuffs Gen 3 or Gen 4. There are other cuffs on the market. SmartCuffs are FDA listed and have been shown in independent studies to be able to measure LOP accurately and reliably. And then you're going to use light dumbbells, resistance bands, or body weight. So light loads. This is what it looks like with one of my athletes who does Olympic lifting. He's using the Gen 3 cuffs where he's inflating the cuffs to a certain percentage. This is the proper location right underneath the deltoid. And he'll inflate these up for the upper extremity anywhere between 40 and 50%. So our basic hypertrophy protocol, use your light load and higher pressures. And we typically recommend starting off with a 30, 15, 15, 15 protocol. It's not absolute, but knowing that you can do 30 reps means that the load is light enough and you're going to be able to get through the protocol. If you can't get through the protocol, your pressures are too high. You're going to want to reduce the pressure or reduce the load or weight. The tempo is slow and controlled. So the first set, you're going to do 30 reps. Sets 2 through 4, you're going to do 15 reps each. You're going to rest 30 seconds in between each set, but you keep the cuffs inflated. So this is considered continuous BFR. Continuous BFR means that during the rest and during the lift, cuffs stay inflated. The pressure is going to stay on the entire time. Our cuffs, what they do is there's an app, and on the app, once you hit that you're now in a rest, the cuffs will recalibrate to make sure that you're still on the right pressure. You then, after you're done with the 30, 15, 15, and you want to move on to the next exercise, you deflate the cuffs for a minute. That allows for reperfusion and is a safety mechanism in order to make sure that you're getting oxygenation to the tissue. So you can use BFR as a full workout replacement, like I mentioned. You can use it as finishers. So I use it a lot of times with high intensity training and then use BFR at the end to fatigue out the tissue. You can use it on recovery days, like for passive or in between games, because you're not causing any muscle damage. So you're not going to reduce force of the muscle on the day after or the next day or even the same day. You can use it during rehab. You can get time efficient sessions, and it's really great during strength deload weeks. So some sample exercises to use, something like a simple bicep curl. For hypertrophy, I typically use isolated exercises or single joint exercises compared to a compound exercise, which would be multi-joint. So here, this is a single joint exercise, a simple barbell bicep curl. A compound exercise example would be a multi-joint or like a squat, where it's involving your hip and your knee. Leg extensions, another isolated exercise, and a squat, which is going to be your compound exercise and a little bit tougher and usually going to be used mostly for strength training, but can still be used for hypertrophy as well. So a couple studies that I wanted to just kind of throw out there. So we got this Cognetti et al. 2022 looking at strength and hypertrophy. And so all these studies will be available so you can take a deeper look at it. I'm not going to go too deep into it, but lots of studies showing hypertrophy and strength adaptations starting at about 3 weeks. Here's another study by Ma, 2024, BFR combined with low load resistance training on muscle strength and thickness. This was a meta-analysis, so that'll summarize. Those meta-analyses are great because they'll summarize numerous studies if you want to like have a conglomeration versus going in and trying to read each individual study. That was that Ma study. Yeah, and then this other study in 2025, 6-week supervised whole body BFR training 3 times a week at 30%, 1 rep max. BFR cuffs were pretty low. We saw significant improvements in strength and size. So some key takeaways: BFR builds muscle effectively with light loads. It's comparable hypertrophy and strength gains using just 20 to 30% of 1 rep max compared to using heavy loads or high intensity at 65 to 90%. But you're also going to get adaptations so about 3 weeks, you're going to start to see size and strength gains. Effective in about 5 or 10 minutes per muscle group. And we have multiple random control trials and meta-analysis showing that BFR is a reliable, evidence-based training. So my next, I do these every month. So next month, the third Thursday of the month, I'll be doing, talking about sarcopenia and how we use this in the aging population. I will take some questions. Stop my screen share.